Hello, I'm Terry J. from Catamount Radio, and I'm doing something that I don't want to do. I thought wearing a mask, I don't like getting shots any more than anybody else. And yet here we are, a year later, doing it all over again with some important information. I used to say to my kid when he was growing up, knowledge is power. And today, knowledge is power still. And the subject is still COVID. I'm happy to be broadcasting on Catamount Radio and PEG TV today with a couple of doctors from Rutland Regional Medical Center, Dr. McCloy, Dr. Hildebrant. Thank you for doing this above and beyond. I know you guys are swamped. You don't want to be here any more than anybody else. You have had it with this stuff as well, and we want to see this go away as soon as possible. Thank you again for doing this.
Thanks for having us.
Oh, thanks so much for having us.
So, yesterday, national news, CBS, Dartmouth Regional Medical Center, right in our backyard. They are our neighbors. You guys have relationships with them. Why are we still here a year later, guys? Why are we here a year later?
Yeah, you know, that's a good question, Terry. And there's a lot of reasons that we've seen this pandemic persist for so long. One thing that has really changed the picture a lot is that this virus has evolved. When we had the native virus back a year and a half ago, we thought we understood how to control it and how to prevent it. And we had really good efforts at getting vaccination, at social distancing, and at masking. And then the game was changed with Delta. Delta is just so much more contagious than the native virus that it has exploded throughout the country. Now, we were very lucky here in Vermont. We had a high vaccination rate early in the beginning of this year, and people were practicing social distancing, and frankly, it was warm. So we did not see a big uptick in cases. But in the last couple of months, that has changed. It's been 10 months since many of us have gotten our vaccine, and it's gotten colder, so we spend more time inside, which is when our typical cold and flu season occurs. Mm-hmm. Those things have made Delta transmission skyrocket, and we've seen just a remarkable number of cases in the last several months because of that.
Mm-hmm. I think from a pediatric perspective also, we're just getting in the swing of vaccinating our ages 5 and older. We've had ages 12 and older for a little while now, and there's been actually really wonderful uptake in the vaccine from the 12 and ups. I think it's about 9. The 5 and ups, we're just starting to kind of roll that out for them, and what we have seen in the data on the state level is that there's the highest rates of infection are really in that age group, 5 to 11. So we, like you mentioned, did a wonderful job promoting and rolling out the vaccine for adults, and then the virus shifted. It said, who is the vulnerable population? And it went for those 5 to 11s and even younger. The data really says 0 to 9, but within that, the 5 to 11s are the highest.
You know, I have a question about how we're doing in our specific area. Mm-hmm. Now, you see other counties around the state. Right now, Rutland's number 2, right behind Chittenden County. We're a lot smaller than Chittenden County. Are we getting the word out enough? I mean, by doing mask mandate. Rutland City bought masks, so we're trying to address this. Are we okay in Rutland County? Are we on the right path? Are we making headway?
I wish I felt that we were doing better than we are. The case counts in Rutland County are very, very high. And it's higher, frankly, than a lot of other communities. And we're seeing it in healthcare. We're seeing it in the emergency department. We're seeing it in the inpatient unit. We're seeing it in our ICU. So the numbers, unfortunately, have not started to go down. They've only gone up since, for the last several months. Mm-hmm. So I wish I could paint a better picture about how we're doing, but I think, unfortunately, right now, we're not doing great.
You know, a year ago, we were talking about washing our hands. This was before we knew that it was, basically through the air, things that we touch. I even asked you a year ago, when I go grocery shopping, I was keeping my groceries in the garage, in the cold garage, for a week before I went down and got them. And then when I got them, I wiped everything down. And I thought that we were really, like you said, we were doing so well at the start of this. We were the example that everybody else looked to in the United States. And now I wonder what happened, and I know we're here to address this, but the thing I really want to know is, why has my colonoscopy been pushed back?
That's a great question. That's a great question.
My question, what about our patients here at the hospital?
Yeah.
I mean, are we addressing the needs of other illnesses, other surgeries, other things that have to happen? Is the hospital still a place that we can go and depend on?
Right, so when we first saw COVID, surge planning was a big part of what we did. In the very beginning, in 2019, we did not see a lot of cases. Even in 2020, we did not see many cases through most of the year until the end of the year. And we developed a very robust surge plan. Unfortunately, a lot of that surge plan was things like, we're going to use this other clinical space so that we can care for patients who have COVID. And that had huge impacts. Closing down our endoscopy unit had huge impacts in our community. Now, the state had sort of required that we did that because of the level of pandemic at the time. We do not want to have to do that again. We want to make a plan that's durable, that we can continue to provide care to our community, because we saw the effects of that a few months ago. We saw very, very high numbers of cases, non-COVID cases, because of deferred care or delayed care. We saw cancer rates increase in our community because those screening tests were not being performed. So our goal is to continue to provide high, excellent service to our community and to make a plan that does not require us to shut down services because of a surge. That, frankly, takes time. We've made some changes to our facility. We've expanded the clinical spaces that are available to care for someone with COVID. So when you're in a hospital and you have a patient with COVID, they need to be in a very special room that has negative pressure. The air in the room is always sucking in and never blowing out, so that the aerosolized COVID will not expose someone else. We changed the entirety of our ICU to be plumbed to negative pressure. We've made some units in the hospital entirely negative pressure to be able to care for those patients. The challenge is twofold. One is volume. We have the hospital takes a lot of time. So to do that, it's going to take more time than we have right now in this particular surge, but that is absolutely something we have discussed about. Do we need to physically increase the size of our hospital? The second one that's really been challenging is staffing. So we can have a huge hospital with lots of beds, but if we don't have the nursing staff to staff that hospital, there's no point in having the beds. So those two things have been really challenging. I'll tell you, for the last several weeks, there have been many discussions daily about exactly where we are with volumes, with staffing, to make sure we can continue to provide a full spectrum of services. We have had sent some communication to our community to say, you may have your procedure delayed or canceled if we have to do it, but we really do not want to do that. We want to provide services to our community at the highest level.
Yeah, that question is a really great question. Can I get the care that I need? And in the outpatient setting, we are seeing volumes like we've never seen also. So it is this convergence of the regular kind of wintertime smattering of pediatric or childhood viruses that we always see, COVID sitting right on top of that. And in addition, as Dr. Hildebrant mentioned, this kind of whole body of catch-up care or deferred care that that needed to happen makes it much more difficult with COVID and all the wintertime viruses. So in the summertime, I sort of felt like, we were just getting a handle on catching all these kids up with their routine physicals and developmental screenings and immunizations, and then we had this onslaught of illness, and it has made to continue to provide preventative care while also addressing all of the acute care that's happening. I know our urgent care settings, our express care settings are really feeling the pinch as they have really been inundated with viral illness. I think as a pediatric practice, community health has done a great job maintaining vaccinations, not even including COVID, but just routine childhood vaccination rates. We've done really well with that, and we're really proud of that. I think that's one of the most important things that we do. But I do worry that, with the volumes that we're seeing, I do worry a little bit about maintaining our pace of preventative care as well.
Now, what if I want to visit somebody at the hospital? Say I've got an uncle in there that had a heart attack. I know the visitation rules have changed. Last year, of course, nobody could go in to see anybody at nursing homes and things like that. It was so sad.
Right.
Where do we stand with visiting people at the hospital right now?
So we recently changed our visitor policy. We were really forced to change our visitor policy based on just the amount of COVID we have in our community right now. Visitors on the inpatient unit are really not permitted. We do have people who require other people in the room for a variety of reasons, such as someone who's having a surgical procedure, who needs to get transported to or from, or needs to receive information from the surgical team about how to care for that patient after the procedure. Obviously, pediatric patients need to have someone else in the room. Their parents, right, need to be in the room. Those individuals are what we call essential support persons, or ESPs. And they, of course, are permitted in the building, but we do not have routine visitors at this time. People who would like to see their loved ones in these trying times, we will facilitate video visits with them using Skype or Zoom or FaceTime, what have you, but we really can't have more people, and it's really just to protect the patients in the hospital. We do a very diligent job in making sure all our staff are screened, are masked, are vaccinated. But with the case counts as high as they are in Rutland right now, we don't want to introduce, people who potentially could bring COVID into a hospital and, have issues related to that.
We're talking about those high cases in the hospital right now. Can you give us a ballpark percentage? I mean, what percentage of the hospital patients are COVID patients?
So higher numbers than we've ever seen. It's just around 20% of the inpatient volume that has COVID patients in it. It fluctuates from day to day and week to week, but it's around 20%.
2 years ago that we didn't have to think about.
Correct.
We've been really lucky in pediatrics that most children handle COVID-19 relatively well and don't require hospital admission. So I will say on the pediatric unit, we have admitted a few children with COVID-19, and in the birthing center, our labor and delivery service, we also manage newborns that are born to COVID-positive parents. So the logistics of that can be a little challenging, but we've been very lucky in terms of not a lot of admissions for pediatric patients. That being said, there have been a number of children who have required tertiary care or with COVID-19 who've required a higher level of care that we have had to transport out because they needed a higher level of care than we can provide at Rutland Regional, simply because we don't have a pediatric intensive care unit. So one of our concerns is, looking forward, we suspect that with the case rates rising, that may be a more common scenario that we'll have to address. And as Dr. Hildebrant mentioned, we're sort of surge planning around that, trying to figure out what do we do with these cases. But for the most part, we're seeing a lot of children with COVID-19, or a relative lot of children with COVID-19 in the outpatient setting, but most of them we're able to manage in the outpatient setting.
And of course, you talked about the transfers, and that is incredibly strained right now.
Yes.
I know our tertiary partners, Dartmouth, UVM, and Albany, the
Yeah.
ability to transfer to those facilities is extremely limited now.
That's right.
We've struggled a lot on the adult side,
Yeah.
and it can often take days before we can make that transfer occur. I think that's changed in many ways for a lot of hospitals just because of the volumes that we've been seeing.
Yeah, yep. And it makes it worrisome. Child in our scenario that maybe doesn't have COVID-19 but does also require a transfer, and
Right.
and we wonder, is that ICU, pediatric ICU bed going to be available at our tertiary partners? In our emergency room, we have a great setup wherein we can connect with UVM or Dartmouth Hitchcock Pediatric Intensive Care via telemedicine to at least support us in the management of maybe a more acutely ill child who is awaiting transport.
This is eye-opening for me, because I always hear about, the only thing I have to worry about is if people are over 65 and obese.
Sure.
Yeah.
Yeah.
So it's an
Yeah.
eye-opener for me to hear you talk about this in this way.
There are, so as I mentioned, most children thankfully do well or get through this illness relatively well. Very sick. And one of the challenges of COVID-19 is we don't know, we have no ability to predict which children are going to get acutely ill or have complications from COVID-19 and which children are going to have a relatively mild course. So we know, especially from the teenage population, that long COVID or prolonged symptoms after infection are not terribly uncommon. Prolonged fatigue, brain fog, headaches can continue for months, and we do see that here and there. And as I mentioned, we have no ability to predict which children are going to end up with those longer-term sequelae. And so the message really is prevent the infection to begin with, so you reduce that chance that maybe your child is one of those that may suffer longer-term consequences.
Right, well, children in school, teenagers, there are a lot more social interaction than I have.
Yeah.
I mean, every day. But it still remains somewhat controversial. Do I want my kid to get the shot? The booster was just approved for teenagers the other
That's
day, right?
Yeah, yesterday, I believe. Yeah.
Yesterday. And you hear parents saying, well, you know, I'm going to get a shot, but they're just kids. So the message is, if you have a chance to get your kid vaccinated,
Get them vaccinated. This is the most highly scrutinized vaccine in the history of the world. It is the research, it's hard to really appreciate the rigor that has gone into the research for the mRNA vaccines, such as Pfizer, which is the vaccine that's approved in the pediatric age group 12 and down, or 18 and down. You know, there have been hundreds of millions of adults vaccinated, and that data is, the safety data for the adult population is excellent. And then dropping down to the adolescents and teenagers, again, a huge amount of vaccines have been given, and the safety data, again, is good. There were 4,600 children in the study for the Pfizer vaccine between ages 5 and 11, and those kids did wonderfully. It was found that they really needed a much smaller dose than the adult population to achieve the same level of immunity. And there's a lot of symptom tracking going on post-vaccine. So I feel very confident about the safety, the amount of research that's been done, the data that we have already, and the kids that we vaccinated to date in that age group are doing very well. So,
you know, for a lot of people, this comes down to an emotional rather than a logical decision. Sometimes it's a political decision, and I can only imagine some of the things that you guys have heard. You guys have probably heard it all. I mean, I hear it when I talk about getting vaccinated on the radio. People call me. I've had people call me and say, I can't believe you're actually buying into that. There are some people that are tuned in right now that may be saying, I can't believe you're buying into that. And I'm like, look, I got to go with you guys. I got to trust you guys. I trust you guys for an appendix. I trust you guys for my colonoscopy that I'm waiting for. I trust you guys for all this stuff. Why would I not trust you now? Why would I not trust you now? Listen, we're doing broadcast live, and you'll also see this recorded. You'll hear it recorded. We're on Catamount Radio, and we're on PEG TV. It's a presentation, a special presentation of COVID information, mainly for Rutland County and Rutland Regional Medical Center. Dr. Hildebrant and Dr. McCloy are here, and we are going to open up the phone lines in just a little while with your questions. So stay with us. You'll have a chance to ask those questions in just a minute. I have to ask about the boosters, and again, I've had people say these things to me, so I'm just going to throw it out there to you guys. Look, I've had a shot. How long is Fauci going to keep this thing going?
Yeah.
You know, listen, I had a shot, and I'm even thinking about getting another shot, but I'm not going to get a booster. And I had somebody come in yesterday and say to me, you know what, they're probably even going to get another booster later. And I always say, good.
Yep.
I hope they're working on all this stuff all the time. What do you say to somebody that doesn't? How do you address that? Is it important to get a booster?
Yeah, so I mean, that's part of the reason the case counts are so high, right? We had, again, robust uptake of vaccine 10 months ago. After a period of time, 6 months, 8 months, the immunity that's associated with that booster, it wanes. And it wanes, you know, in a way that you still are protected against maybe going to the ICU or going to the inpatient unit because of COVID, but you will get symptoms of mild COVID. You will get a runny nose, a sore throat, and a cough. You can still, though, transmit it to someone else, either in your family, a friend, or a child who is unvaccinated. And that person can get very sick. And that is what we're seeing. We're seeing the unvaccinated individuals. Those are the people who land in the emergency department. Those are the people who land in the hospital. But if you don't get a booster shot, you're not protecting those people. Vaccination and boosters, the way I try to tell this to my patients, it's really not a decision you should be making for yourself. It's a decision you should be making for your family, for your community, and for your friends. Do you want to protect them to make sure you're not contributing to the spread of COVID? Because if you get a shot, you can protect your friends and family and community from the devastating effects of this virus. The booster shots are dramatically reducing the incidence of COVID in people who get them. In other studies in Israel, when they rolled out the booster shot, the transmission rate of COVID just plummeted to nothing. Unfortunately, we have not seen the robust uptake of the booster shot as we did with the initial vaccine series, and that's part of the reason we're seeing such high case counts now. Viruses mutate. We know that. We've talked about Delta, which is what we're dealing with right now. Omicron is the next variant that's coming to our shores. We don't know a lot about Omicron, but we do know COVID will mutate. It will change over time in the same way the flu does and many other viruses do. And we will have to keep on top of this. We will have to that we are staying immunized against this deadly virus and that it's effective against treating the virus that we have. The booster shot data is very compelling that it protects you against COVID, it reduces case counts, and really the single best thing you can do to protect your family and protect your community.
It's been nice to hear also that with Omicron, we're still learning a lot very quickly about it, but initial reports are showing that probably the Pfizer vaccine does have some efficacy against Omicron. And so that is another reason to receive a booster if you are in an eligible age group or an eligible population to receive one, because you may have some immunity already against Delta or the prior strains, but Omicron is coming along, and if your immunity is waning, you may not be protected from that.
I want to go back to the pediatric side of things,
Sure.
and I want to talk about schools for a second.
Sure.
I heard somebody say COVID loves cold. Well, yeah, because we're all driven inside, close together. I loved to take my dad to the basketball games.
Yes.
And we watched the games, and we even, snowy nights, we're all in that gym
Yeah.
yelling and cheering. Or I want to go to the theater. I haven't been to a movie. I haven't been to a movie in 2 years. I want to go, or a year and a half, whatever it was. I mean, I want to go. But you want kids to have normal lives. And if you're a kid, if you're a young kid, this has become part of your normal now. This is part of their history. How do we their kids' games? Everybody wants kids to play sports.
Absolutely.
Everybody wants this back to where it's supposed to be.
Yeah, I mean, really, the way back, the way we have to get us back to normal is vaccination. That is our step in the right direction. And now, really, except for preschoolers, every school-age child has the opportunity right now to be vaccinated. And if children are fully vaccinated, those opportunities open right back up for them. They can participate in sports, they can participate in theater, they can safely do these things, getting them back to what we would consider a normal life. I have a 7-year-old and a 10-year-old myself, and so certainly have lived this with them, and particularly my 7-year-old went home, halfway through kindergarten, and so her school experience has been very disrupted by COVID. So I think vaccination and getting our kids to a point where they are fully vaccinated will allow them to participate in these regular events much more safely. With regard to sporting events and indoor activities that would include families, sort of the same thing. Like, adults need to get vaccinated to be able to safely be in a school or be in a gym, or and not be a risk to those that are maybe unvaccinated or yet unvaccinated. But I think that's coming.
And I would say that not all activities or not all situations are equal risk, right? The most high-risk activity is a large indoor unmasked gathering, where people can spread the virus, contract the virus. That is, by and large, the most risky behavior. If everyone's vaccinated and boosted, everyone is wearing a mask, the risk goes way down. The problem is, as we've seen, not everybody's wearing a mask. And if 1 or 2 people with COVID are not wearing a mask, it could potentially expose everyone at that, even though they're wearing this kind of mask. For people who find themselves in a situation where they do need to go into a gathering or something of that nature, even if you're vaccinated and boosted, I would still strongly recommend a KN95 or KF94 mask. These are high-level filtering masks that you can buy over the counter at a grocery store or at a pharmacy, at a hardware store, that can increase your protection against this virus in those types of gatherings. Again, vaccination, boosting, absolutely most important thing. If you do, though, go into a grocery store, as an example, we all have to go grocery shopping, and you know there's going to be people there who are not wearing masks, I would encourage you strongly to wear a KN95 or a KF94.
I'm the guy wearing the cheesy mask with 2 doctors today, so talk about it. And I had another mask in the vehicle, and I grabbed one, and I realized I had the wrong one. But I do have the good masks. I just want you to know that. And I believe in them. I hear a lot of people say, freedom. It's my freedom to choose whether or not to get vaccinated. And I always say, if you want to be free to go to the game, free to go to the movies, free to do whatever you want, your freedom, you can write your own ticket. When I was eligible for the vaccine, I thought I hit the lottery. I mean, I was like, woohoo! And you see a lot of those posts on social media.
Yeah.
Well, they no longer give their social security ID number and their vaccine number by taking a photo of their vaccine card, but they say I'm boosted. And to me, that makes me feel good to know that. All right. 70151. That is the phone number. 747-0151, and Mike is waiting to say something. Hello, go ahead.
Good morning. I have 3 questions, all connected to each other.
Okay.
The problem is, do we have any information regarding the mask-wearing behaviors of the people who are currently testing positive for COVID?
Yeah, so do we have data anecdotal? So I can tell you our experience in the hospital. Generally, when we have people who land in the hospital sick with COVID, they can identify the gathering that caused them to be there. Okay, many times. They had a dinner party. They had a holiday gathering of some kind, and it was unmasked. Sometimes people aren't able to identify where they contracted the illness, but I would say most of the time, majority of the time that we see patients, they do know where they caught it, and it's related to an unmasked gathering, small group gathering.
I can comment on that from the pediatric side also. Most children contract COVID-19 within their household and not out in their community, for example, not in the school setting. It's very low. Schools have done an amazing job with their COVID-19 precautions and full masking and distancing, hand washing, all these things. So children predominantly are contracting COVID-19 within their own household or at small gatherings such as sleepovers or play dates. And so again, those are unmasked situations for children.
Anything else, Mike?
That's not my question. My question is, do we have any data regarding the mask-wearing behaviors of people who are currently... Do we ask people, okay, you have tested positive, have you been wearing a mask in your life? Yes, no, or sometimes?
Yeah, so again, data anecdotal, not a data set that is collected by the Vermont Department of Health.
Like when a person has a car accident, we know instantly whether they were wearing a seatbelt or not, whether they were wearing a helmet or not.
Yep.
If they contract COVID, we know whether they were vaccinated or not.
Yep. And
Do we
again,
not ask whether they've been wearing a mask regularly in their life or not?
when they land in the emergency department, we do for those patients. And again, overwhelmingly, it's due to unmasked gatherings.
But have they been wearing masks in their lives? The people who have tested positive, do they say, yes, I regularly wear a mask to school, at work, in public, in the jail?
Yeah, that's a great question, and something that I think our public health service should really be looking into. You know, it's one of those public health measures that, you know, I would tap the Department of Health to be looking into.
I've been trying for 6 weeks to get that question answered, and I just can't seem to get through. I'm relieved today to be able to finally ask somebody. Another question that goes with that is, do we know how long the pathogen stays viable on the surface of a paper or cloth mask?
Yeah, so there have been studies on this. Way back in the beginning of this, they studied the viability of COVID in a variety of different circumstances and surfaces. The longest viability, I believe, was on stainless steel or stone, and there was a big variability. And that's why, again, 20 months ago, there was recommendations about mail and other things remaining outside for 3 days. Between 3 and 4 days is how long COVID can live on a paper surface, so like a paper mask or a piece of mail. Beyond that, it's not viable. Now, I will tell you in practice, this is, you know, research studies done on these types of things. In practice, transmission is predominantly airborne. It's related to airborne particles that you are exposed to when you're breathing the same air as someone else. While yes, it does exist on surfaces, it's rare that that's the way people are contracting this.
I know I work with, in my wood shop here, I work with a lot of different filters. I've got filters on machinery and filters that take the dust out of the air. And I know that those filters collect a lot of dust on the positive side, if you will, of the filter. And I'm wondering if we have any data as far as the masks of COVID-positive people being tested to see whether more of it is collecting on the inside of the mask or on the outside of the mask.
Yeah, so the way all those filtering masks work is they filter out a percentage of particles at a certain size. So an N95 mask, which is a medical grade NIOSH approved mask, is tested to make sure that it can filter 95% of particles 3 microns or larger. Okay. to use that type of mask in a medical setting, you have to be trained in its use and you have to be fitted to make sure that it has a tight seal against your face and no particles are going inside. A similar type of mask you can see in construction. You can see, the KN95s or the KF94s are very similar types of masks. They just aren't NIOSH approved or tested in the same way to the fit of the person. But the way those are designed, and they are tested by external agencies, is to make sure that the particles are not getting through.
Okay, but on the paper masks and the cloth masks, and it sounds like perhaps the type that Terry is wearing right now, the people that are pulling the shirt up over their face, grabbing a mask, putting it on, stuffing it up their sleeve, putting it back on, putting it on top of their head, hanging it on their rearview mirror, putting it back on, grabbing it off the coat hook, you know what I'm talking about.
Exactly.
Is it at all possible that in the 3 or 4 days that the pathogen stays viable on the surface of these masks, that people can be grabbing them, touching them, it's filtering and collecting the pathogen, and then they're getting it on their hands, getting it on themselves, scratching their eyes, and getting the pathogen that way?
Yeah, so when, again, medical personnel, when we wear these the filtering types of masks and medical procedures, we very carefully put them on and take them off. There's a whole process to make sure that you don't self-contaminate yourself when you're caring for someone with COVID. So there is a lot of people who are not practicing great mask etiquette, for sure. These are disposable masks. They are designed to be worn and thrown out after use. You really should not be keeping them in your pocket or in any other way continuing to use them, because if they're working the way they're intended, they will potentially have some COVID on it. Now, I'll tell you, the primary purpose of wearing this is not to prevent COVID from coming onto you, it's to prevent you from spreading COVID to other people. That being said, after you use a single-use mask of this nature, you should throw it out. Cloth masks should be regularly laundered, and that will kill the virus if you put it through a normal wash cycle. But care should be taken with wearing masks, and there is a lot of people who don't appropriately use these types of masks.
I would say anecdotally, an overwhelming majority of people that I see in the community wearing masks are not we're currently describing or the CDC calls for, including members of my own family. I'm seeing kids running in and out of schools, grabbing masks off the floor of the car, throwing it on, running around. And it almost lines up with the data that I saw not quite a year ago, 8 or 9 months ago, April and May, of the 13 states that still had mask mandates. They were the 13 states in the U.S. that had rising cases of COVID. The 13 states that did not ever have a mask mandate did not have any rising cases, and the 13 states that had gotten rid of recently their mask mandates at that time did not have rising cases. It was the 13 states that had mask mandates. Now, I know that leads to a bunch of other questions regarding what are the actual mask-wearing behaviors, et cetera.
Sure.
But it seems like a piece of the conversation that we are seriously lacking and seems incredibly important.
I think that we can be quite reassured that masking is not causing increased transmission. So as Dr. Hildebrant mentioned, I think one of the most important things about single-use masks and cloth masks is that they contain your own droplets. So they prevent your aerosols, your own breath, from becoming a plume out in the air that others could breathe in. So if you are someone that is in an incubation phase, you have COVID, and you're in an incubation phase where maybe you don't know you have it yet, you're not symptomatic yet, you're not shedding virus into the air for another person to contract. So the masks themselves are containing that to prevent the spread to others. Will they perfectly filter COVID-19 from the environment, perfectly prevent it from getting, from getting to you? No, not necessarily. But these are designed, I think, as Dr. Hildebrant mentioned, just really to protect others as their primary purpose.
And we've seen in studies where mask mandates have been instituted that the transmission rate of COVID has gone down dramatically.
Absolutely.
Of the public health measures that have reduced the transmission rate, or the R value of the rate of increase of COVID transmission, mask mandates have dramatically dramatically reduce that. So we do know that masking does work. It's one of the only means that actually does prevent the transmission. You know, vaccination clearly number one, masking is number two.
I'm not sure that the data that I was looking at lines up with what you're saying.
Yeah, I understand that. I would respectfully disagree. You know, based on the scientific studies we've seen, overwhelming amount of evidence that shows that masking does dramatically reduce the incidence of transmission of COVID.
I think
Are you able to cite one of the cases? One of the studies?
I can.
And I think correlation isn't causation.
That's
so
true.
sometimes we have seen in the pandemic where there are sort of states or cities that have extremely high transmission, and so mask mandates are implemented to try to quell that and really get that under control. And so that would be a circumstance where you have, you know, it's an association, but not a causation. You can't lead to that it, you know, caused it altogether.
Right. I think that's a common misunderstanding too, that around between causation and correlation.
Correlation and causation.
Yeah, if you guys have more information about that, we can make it available to the radio stations and to PEG
Absolutely.
TV
Sure.
and to Mike. Good questions, Mike. And Mike, forgive me for the mask that I'm wearing today.
I personally don't believe that they were a good idea for our society to be using this route as a mitigation strategy. And so, you know, one of the things I have said to my own son is, look, your school is requiring masks. Your mom says, you know, this is better than nothing, follows that whole line of thought. And I've said to him, you have to do what you need to do to get through life, but please understand that when you wear this, you're supposed to be putting on a fresh one, touching it only with your pinkies, washing your hands before and after you put it on, wearing it the entire time you're out in public, and then throwing it away or laundering it immediately when you're done with it. That's what the CDC says.
That sounds good.
Now, he doesn't do that because it's impossible for him as a 14-year-old
Right.
to follow this.
Right.
He's in and out of the school with the same mask, taking breaks, taking it off for lunch, putting it, you know, on his arm, throwing it on the ground, picking it up. That's the reality of it. I understand what the theory is supposed to be. And I do understand the difference between causation and correlation.
Keep in mind, Mike, that if he's not wearing the mask, everything he's breathing in is in his nose, right? So, you know, having COVID covering the mask is certainly better than having it in his nose, which is the alternative. And that's the whole purpose of you know, wearing a mask.
I will move along and look for further discussion on this topic.
Good. Mike, thank you for your
Thank
questions.
you.
Really interesting, man. Thank you.
All right, see ya.
And I do have to do, I think we all have to do better. Obviously, you guys, you've been wearing masks before they were in style. Do either of you have festive Christmas masks?
I
Or
do.
would that be like a bad thing
This
for a
is as
doctor
close
to
as
do?
I'm going to get. Actually, no, I don't, but that would be a great idea for my pediatric office.
Yeah.
I'll keep that in mind.
And I could see, Dr. Hildebrant, I could see you wearing that mask with another one over the top of it.
Sure.
It might be harder to hear you or harder to breathe, but I think you could do. Listen, we have another question. Boy, this is probably going to be the most important question, and this is the question that everybody is getting. With COVID numbers so high in the Rutland County area, what kind of gathering should we be doing for the holidays?
Yeah, that is a great question.
I mean, okay, Grandma, you haven't had your booster. You're staying home this
Yeah.
year.
We've a little bit had a trial run of that, right, in the last few weeks with Thanksgiving. So I think in the last couple of years, we've missed out on a lot. And so people really do want to get together. They really want to see their loved ones and enjoy themselves. And I do think there are safe ways to do that. If everyone in your family or your friend group who's planning to gather is fully vaccinated and boosted, if eligible, and no one has any symptoms of illness, and you can do a home kit self-antigen test, and they're all negative, I think that is the safest way to go into a gathering. That would be my recommendation, those 3 layers of protection. If you wanted to add, you could do masking, but I think I think those are the strategies to implement. Vaccination,
Okay,
boosting.
I'm going to put
Yeah.
you on the spot,
Okay,
Dr.
sure.
McCloy.
Yeah, perfect.
What are your holiday plans?
So for Christmas, I don't have any gatherings planned at the moment.
Okay.
However, I will say that I do have a daughter who is in the Nutcracker performance at the Paramount. And that was something that we really had to think hard about in terms of how would we ensure that she was safe. So a few things. She will be fully vaccinated. That means she'll be 2 weeks post her second dose of Pfizer vaccine this coming Monday. The Paramount Theater has implemented this great program where to come in and watch the show, you must show proof of vaccination or within 72 hours have a negative PCR test for COVID. And everyone will be masked. There's a mask requirement to be an attendee of the show, and all the dancers will be masked. So there are ways to, I think, sort of safely do some of these more fun things. And that's an example of some mitigation strategies I think that can be effective.
I think the other alternative, so I have a family member who is not vaccinated, not fully vaccinated, and unfortunately can't come and join us for the holidays. And having the option for a virtual holiday actually works quite well. We did that last year at the Hildebrant household. We had a screen, actually a couple of different cameras and screens open, and what was really nice, I have young kids, I have an 8 and 10-year-old, and my family from all over the country could see them, watch them, open their presents, and people really appreciated that. There are, keeping the gatherings small in size is important, and again, if you can't protect your family, you should be very careful about what you do. So, our kids at that point were not vaccinated, and we did not feel comfortable having people over. By the holidays this year, they will be fully vaccinated. We are going to have some visitors that we know are vaccinated and boosted. It's a small number of people, but unfortunately, there's some people who can't come because my wife and I just don't feel as though it's the right decision, and we're going to offer a virtual option for anyone who would like to join.
It has been a dividing point for some families, some coworkers, some former friends. Mandate in effect in New York City for restaurants. Broadway is back, but you have to have your proof of vaccination and proof of your COVID test. Somebody said, well, if we make masking mandated, it will kill business. Or if we require COVID cards to get into a restaurant, it'll kill business. The argument was that it'll increase business because people will feel safer. I'm going to ask you both, at the risk of getting a phone call. Actually, I hope we do get a phone call. 747-0151. 747-0151 if you want to ask these questions yourself. I'm going to ask you both, how do you feel about masking mandates or COVID mandates, boosters included, to go to someplace? How do you feel about that as far as the business climate?
That's a real tough question, Terry. And I don't think that there's one answer for every community in America for this, and there's certainly not one answer at all times. I think you have to take into consideration case counts, and when your case counts are really high, like they are in Rutland right now, you don't want to have people not go into those places for fear of contracting COVID. When case counts go down, me and my family, we hunker down. If and this is for me personally, if I knew that I could safely go to a place, I would do that. So I think it depends on the situation at hand. I don't think it's a blanket statement that any one community or any one place can make for all eternity. I think it's something that has to evolve with time. It's a really challenging thing, though, because, again, people have strong emotions about this, and I think the people who are making these decisions are trying to make the best decisions available, but it is a really challenging thing.
With the current case counts being so high, in the context of Rutland County specifically right now, I am in support of a mask mandate, and that is because it is my job professionally to keep people safe. And I do believe strongly in the data behind masking. Masking prevents COVID-19 transmission. And I agree with the viewpoint that that people feel safer going into a business that they know is protecting their customers. And so for that reason, in the current context of the high case counts right now, I think I am in support of that, but were the cases to really drop off and the transmission rate be low, that would be a different story, I think.
I feel safer. He said their COVID shot and their booster and they're wearing a mask.
Absolutely.
I'm more likely to go there.
Yeah.
As a matter of fact, I feel freer there than I do someplace else, not held prisoner to the disease. If I could address the boosters again for a second. The first thing everybody always seems to ask, you had your booster, how sick did you get? And I said, well, I had a headache and my neck was sore and my shoulder was sore this time. And I said, oh, well, I don't like, and I'm like, well, that's a good thing, guys, right? If worrying about getting the booster and the effect of the booster is your biggest worry, then you haven't. Please help me out with these friends of mine that are worried about getting a booster shot.
Yeah, and that is exactly the right approach, Terry, that the booster shot, does it have effects in your body? Yeah, absolutely. This is an incredibly inflammatory condition. It will cause inflammation through a lot of your body. And if you get a booster shot, it's going to induce, albeit at a much lower level, the same type of response, an inflammatory response. You will feel muscle aches. You'll feel maybe some sore joints. It's generally short-lived and similar to previous iterations of the vaccine. My anecdotal experience has been people have had a less response in terms of those symptoms with the booster than they did with the initial series, but everybody's a little bit different with this. What's definitely the case, though, is the symptoms associated with this shot are far less than if you were to contract COVID, where you will have that times 10, times 100, these same symptoms plus a whole bunch of other ones that could be life-threatening. And the booster shot can absolutely reduce the likelihood that you actually contract the illness, not just get sick and in the ICU, but actually contract the illness. So I would strongly suggest that. This is such a highly contagious virus. If you think you won't be exposed to it, you're fooling yourself. You're going to be exposed to this virus at some point in the next several weeks to months. And if you can put up all the defenses possible to prevent yourself from getting it, that is what I would recommend.
Dr. McCloy, I see you nodding your head. Yes.
I'm in absolute full agreement.
Yeah.
Yeah, I think it's so important to vaccinate. I was just thinking about the point about inflammation. So yes, the vaccine induces an immune response, and it is a very controlled immune response, making antibodies against the spike protein on the coronavirus. In COVID infection, one of the things that's the hardest to control is a sort of rogue or out of control immune response that the body has. And in the pediatric population, a rare but possible complication of COVID infection is a few weeks down the road, something called multisystem inflammatory syndrome of children. And that is sort of the feared complication of COVID-19 in children, wherein they have multi-system inflammation, organ complications requiring pretty extensive ICU care. And this is rare, but it has been seen all across the country. It is a known complication of COVID that we want to do everything we possibly can do to avoid, because there is no way to predict which kids are going to get that. Right. Even if they have a very mild course of illness with COVID infection, they may have inflammatory syndrome later, it's not just if they had a severe course initially. So vaccination is this, it is a very small price to pay in terms of symptoms compared to, what could be in terms of a negative outcome. It's a very controlled immune response with great benefit to get a vaccine.
Thank you. We have a caller on line 1. We did. Bill, are you there? No. Apparently, I don't know what I'm doing. Bill is on line 2. Or he was. Okay, well, we're waiting for that. Because you guys have been under such pressure, the burnout factor what you guys face. And right now, you're under. So you've got the pressure of the cases coming in, plus people wondering if we're doing the right thing. How are people coping at Rutland Regional Medical Center with all of this stuff watching? I know you probably don't have enough people. You have too many patients, not enough beds. Yeah. What is going on with your staff?
Yeah, so again, volumes have been very high, and they've been very high for months. Even before we saw our current peak in COVID cases, we saw high volumes in the hospital. Our inpatient service has been stretched and taxed, and people are tired. I mean, there's an element of fatigue that's in all of healthcare right now. It's just been a very long time dealing with high volumes of patients. And when you add into that staffing challenges, it just makes it that much worse. When you don't have the bodies you need to care for the people that are in front of you, that can be very challenging for the people who are there, whether it's in the emergency department, the inpatient unit, outpatient, everywhere. So there's definitely a level of fatigue. My impression in talking with staff in the hospital and elsewhere is, very much optimistic and upbeat. People are, generally in our community, very much have a can-do attitude, but this has been really challenging, and people are exhausted by this. It's been a long slog.
I will agree with that. We've never seen the volumes that we're seeing right now in terms of illness, and as I mentioned before, it's not just COVID, it's all the other wintertime viruses that we routinely see. We were exempted a little bit last winter from the brunt of the usual illness that we see because people really were isolating more, they were staying home more, but now everybody's kind of back together. We're seeing a lot more illness, and it is exhausting. The days are long. There's very little recovery time between shifts, and I do see that taking a toll on our staff, absolutely. I think that's something you had asked earlier about freedoms, and when someone makes the choice not to be vaccinated, that is a choice that they're making for themselves, but I think sometimes what's not realized is the ripple effect or the community consequence of that. If they contract COVID and they come into the emergency department, there might be 20 more people that they're going to interact with in the course of their treatment, or maybe more. And so it's not a decision that you're making just for your own body. There are consequences in your family and your community and the care community in Rutland as well, and everywhere.
Listen, we tried to get to or not, Bill. All right, let's go with Paul. Paul, are you there?
Hi, how are you?
Good. We have a couple minutes left. If you could ask your question, and then I'll let these guys answer it, and then we'll say goodbye.
Sure. I mean, this is, absolutely the biggest earth crisis we've had in our lifetime. It's just been an American nightmare. I mean, the whole thing has been the bane of my existence as a small business owner. So for me, I just wish people would have heart and mask up so we could stop living in fear. I see lots of stooges throw down masks on the ground, and they aren't coming face to face with this overall problem. As a small business owner, people walk in my store and they're acting all crass and they spread germs because they won't even wear a mask for 7 seconds. They're in the store. So I feel like those of us us who are taking it seriously and getting vaccinated, we're the exploited because everyone else is ruining it for us. Their refusal to take care of themselves, it's like they've got these suicidal tendencies almost. It's like there's all this misinformation and propaganda and confusion. Every time we turn a corner, there's more casualties, more terror. Just absolute Murphy's Law out there. So, I mean, look, the one thing I just want to say, I don't trust the government. But in this case, if people are against all authority, we're not going to turn a corner on this because everyone just seems to have a negative approach. And this social distortion among everyone is killing us.
Well put.
Thank you for that
Paul.
comment.
I've been in the business where the masks were required and they flaunt it. I've been there with you, man, and I can understand what it be. As you're a business owner, you're meeting all these people all the time. All these people. If you're a busy business, you have hundreds of people coming in your face all the time, all day long. Paul, I'm going to hang up and let these guys respond.
Yeah, I mean, I think one thing that is really challenging for business owners is to protect their people. If nothing else, you don't want to lose employees because they're sick from COVID and could be out for weeks. And I think people lose sight of that the businesses are struggling. The bodies are not there. There's staffing challenges everywhere. And they think it's about themselves. And it's really, really not. It's about the people that are around you. You want to be respectful of those that are around you, as we all are in Vermont. We want to respect our small businesses. We want to respect our communities. And the best way to do that is to wear a mask right now, to get vaccinated and to wear a mask.
Guys, we are out of time, but thank you so much for doing this. Hang in there. I know that your first rule is do no harm. Mm-hmm. You wouldn't be out here telling us this if you were trying to do some kind of political thing or anti-business thing or whatever. Your number one thing is to take care of our community, and we thank you for it.
Thank you so much for having us. I would love to say one little plug for our vaccination clinics. If anyone has any questions or concerns about the vaccine, they want their child to be vaccinated, please contact our office, at Community Health Pediatrics. We're happy to provide information and help you with vaccination. Or if you just want to talk about the vaccine, we're there for you. Thank you for having us.
Thank you so much.
I'm Terry J. from Catamount Radio, along with PEG TV, presenting this special information about COVID-19 around Rutland County and beyond. I'd like to thank Dr. Hildebrant and Dr. McCloy, and we really, I can't tell you guys how much, Dr. McCloy, how much we appreciate the fact that you did this. And we appreciate everybody in the medical field. For now, that's the information that we have, and hopefully we won't have to do this again.